Now, Easter holidays are approaching. Many countries are concerned that the COVID-19 infection numbers could go up, of course, South Africa among them. Some countries are already detecting signs of a third wave in Europe. In Africa, Kenyan President Uhuru Kenyatta was reviewing the lockdown regulations as fears of a third wave gripped that nation. Let's find out what the picture is. I'm joined by our foreign editor, Sophie Mokoena. Sophie, thank you. So not only South Africa, which countries are you watching that are really watching their numbers?
Well, of course, you know that some countries on the continent are already having challenges. But in Europe in particular, you talk about countries such as France, countries such as Germany. And therefore, today, an hour ago, the World Health Organization had a media briefing where they did confirm that numbers are rising around the world. Let's take a listen at what Dr. Maria van Kerkhoff, one of the senior officials of the WHO, had to say earlier on about the rising numbers.
I think you were asking about if we were seeing signs of a third wave. We are seeing signs of increasing transmission around the world. And there's a number of there's a number of factors that are associated with this. We are not out of this pandemic. The pandemic is not over. I know we are over it, but it is not over us. We are still in the acute phase of this pandemic, where in many parts of the world, the virus is still in control of our lives. We are not in control of the virus. That is not true all over the world. Some countries have actually shown that we can control COVID with the tools at hand, with the addition of vaccination. But in fact, some countries have actually controlled COVID without vaccination yet. And I think it's important to remind everyone that we know a lot about this virus. We know about how it spreads, and it really is a factor of our mixing patterns. When we see people mixing and increasing the number of contacts that they have, if people are spending a long amount of time together, if they're mixing with more individuals, more families, the virus will take an opportunity to spread. So we have seen with some holidays, we certainly saw this over December, January holidays, where people had increased the amount of mixing that they had with other families. We saw transmission increase dramatically in a number of countries. We now have virus variants, at least 3 variants of concern that WHO is tracking: the B.1.1.7 that was first identified in the United Kingdom, the B.1.351 that was first identified in South Africa, and the P.1 variant that is circulating in Brazil that was first identified in a traveler in Japan. There are more variants of interest that are also being tracked. The variants of concern are more transmissible. And if you have a more transmissible virus, it means it can spread more easily. If we increase our mixing patterns, if we have virus variants, transmission will increase. We're now into the 5th week where globally we have seen an increase in transmission around the world. I mentioned in my earlier answer, now all WHO regions are seeing an increase in transmission compared to the last week. This is important because 15 months in, people want this to be over, but we still have to put in the work. All of us have a role to play here in reducing transmission, and this includes during holidays. All of us want to spend time with our families and travel around, and there are safe ways to be able to start to do this, but we need to think about what each of us are doing every day, what we need to be doing versus what we really want to do. We will get there. We will get to a point where this pandemic will be over. I promise we will get there. But we need to put in the work now to drive transmission down, especially as we are rolling out vaccines and vaccinations around the world. So think about what you are able to do during this holiday period. Think about, there are many holidays that are coming up. You can celebrate a lot of these virtually. And in some situations you can meet, and you can meet outdoors instead of indoors. And if you do need to meet with others, limit the time that you are together. Do this outdoors as opposed to indoors. Make sure you keep your physical distancing, you wear your masks. All of these measures still hold true. This is true if you're celebrating Passover or Easter or your child's birthday party. Each of these events has the potential to either facilitate transmission or not. So all of us have this role to play in the decisions that we make to make sure that we don't spread the virus, that we don't get infected at first, but if we get infected, that we isolate, we get a hold of our contacts so they could be quarantined, and we stop transmission. We break the chains of transmission. We can do this. We need to continue to do this, especially through these holidays in the next few months.
all the WHO regions are reporting numbers going up, and therefore it is a problem. And the other problem today, Dr. Tedros indicated that they are now facing a lot of challenges. They've got reports of fake vaccines. Let's take a listen at what is happening now in the pharmaceutical industry, particularly people who are dubious.
Some falsified products are also being sold as vaccines on the internet, especially on the dark web. And we are aware of other reports of corruption and reuse of empty vaccine vials. We urge the secure disposal or destruction of used and empty vaccine vials to prevent them from being reused by criminal groups. And we urge all people not to buy vaccines outside government-run vaccination programs. Any vaccine bought outside these programs may be substandard or falsified, with the potential to cause serious harm. It's important to remember that any harm caused by a falsified product does not reflect a safety failure of the genuine vaccine.
Something else, Sophie, that the WHO often talks about is vaccine nationalism at a time where many countries are in desperate need of vaccines, us among them. What was the WHO saying today?
Today, Dr. Tedros tried to answer a question, particularly around reports that some countries have taken a decision to stop the pharmaceutical companies or people who are manufacturing vaccines in their countries to stop exporting vaccines. We know South Africa and many other countries, we don't have facilities to manufacture vaccines, and therefore we are importing this important vaccine that we need. And India in particular, there are reports that because of the numbers that are going up, they've taken a decision not to export what they have currently. But Dr. Tedros was quick to indicate that he had a discussion with India. Let's take a listen at what he had to say about India continuing to make vaccines available.
What's happening now is it's not export ban from India, as far as we know. But as you may know, the number of cases in India is on the increase. So they need more vaccines also to use locally in order to fight the increasing number of cases. So that's understandable. But at the same time, we're already in discussion to keep a balance so that they can use locally, but at the same time continue to provide other countries vaccines from the Serum Institute of India. So we hope that the two could be addressed and we have a balanced solution. But I would like to use this opportunity actually to thank India, and I know they will continue to collaborate with COVAX and with WHO.
All right, let's get back to those fears of a third wave. Sophie, we know Europe on high alert, many of the countries there. And also, are there countries who've already sort of detected the signs in Africa?
Yes, indeed. You know that today the president of Kenya, Uhuru Kenyatta, announced measures to ensure that the country is able to manage the current numbers that are going up. And these numbers are attributed to perhaps signs of a third wave. Let's take a listen again at President Uhuru Kenyatta earlier on when he was announcing measures that the country is taking to deal with this problem.
All gatherings and in-person meetings of whatever nature are suspended within the counties of Nairobi, Kajiado, Machakos, Kiambu, and Nakuru until further notice. That all in-person meetings of the Cabinet and its committees, with the exception of the meetings of the National Security Council, are suspended until further notice. That with the concurrence of the parliamentary leadership of both houses of Parliament and with the concurrence of the county leadership, the ordinary sessions of the August House, including those of their committees, and the ordinary sessions of the county assemblies of Nairobi, Machakos, Kajiado, Kiambu, and Nakuru are hereby suspended until further notice. In accordance with the standing orders of the National Assembly and the Senate, the two speakers of Parliament will move to effect this decision, as will the speakers of the respective county assemblies.
All right, so Kenya taking action. In South Africa, there's still speculation about whether Easter could be dampened somewhat by new regulations, Sophie. So we know transmission is pretty low, no signs of the third wave yet. But Professor Karim warning us earlier, if people do have huge gatherings, that's what happened last time. What are you expecting?
I expect the president next week to make an announcement in terms of how we're going to deal with holidays. But also, there are reports, our sources are telling us the government is worried about the third wave. And remember, when we come back, we would be heading towards winter time. And therefore, that will complicate the whole matter. And therefore, I think as we speak, the president is consulting different stakeholders. Or next week, I am sure he's going to meet provinces. Provinces will make inputs in terms of their observations. Definitely, the president will have to say something before Easter holidays. I think it's up to us as South Africans to be responsible. Maria van Kerkhoff has indicated what we can do, and she also indicated that other countries who don't have the luxury of vaccinating their population, they have started and they have stuck to those protocols, non-pharmaceutical protocols, and they are working. And therefore, please, 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 Africa, let's continue. Wash our hands, wear our masks, avoid crowded places. If you don't have a soap to wash your hands, you are somewhere, sanitize your hands. Avoid crowded places. Keep a distance, simple as all, and I think many lives will be saved. And therefore, I think that's all what we can do to assist in ensuring that we save life.
Personal responsibility, so important. Thank you very much, our foreign editor, Sophie Mokoena. And yes, if the president does speak, as soon as he does, we will bring you that live.